Welcome to the deep dive. Today we're looking into something pretty interesting, how AI, artificial intelligence, is really starting to help out healthcare business analysts.
Yeah, it's definitely changing things.
We've got a great real-world example, actually, how one analyst used AI to, well, streamline a big project, redesigning a hospital's patient portal.
And that's such a common scenario.
Yeah.
Healthcare, demands real accuracy, super clear communication. Business analysts, well, we're often right in the middle of it all.
Exactly. You're the bridge trying to connect all these different teams and stakeholders.
hmm
Picture this, right? Monday morning meeting, City Care Hospital. You've got project managers, developers, clinicians, all talking patient portal redesign. Ideas flying everywhere.
Oh, yeah. It can get chaotic, fast, lots of different viewpoints, needs.
So traditionally, the analyst steps in,
Mm,
sorts through it all. But that means tons of manual note-taking, right? Hours and hours just drafting documents.
Absolutely. So much time just getting the basics down on paper, structuring everything that was said. It's critical work, but time-consuming.
Right. Time you could be using for, I don't know, deeper analysis, asking more strategic questions. But what if AI could lend a hand with that initial heavy lifting, like a co-pilot?
That's exactly the idea. It's not about replacing the analyst's judgment or skills. It's about using AI to handle some of the, let's say, repetitive tasks. It frees me up.
Yeah. Okay, so let's dive into this specific example. You actually used this approach at CityCare on that patient portal project,
I did, yes. It started pretty simply, actually. We had our big kickoff meeting for the redesign,
the chaotic one we imagined.
pretty much. So the first step was just hitting record in Microsoft Teams. Standard practice for us anyway.
Okay, so you capture everything, no missed details.
Exactly. And then, after the meeting, I exported the transcript. Just raw text of who said what.
And then straight to AI.
Pretty much. I used the free version of ChatGPT. Just copied and pasted the whole transcript in. But here's the crucial bit, the prompt.
Telling the AI what to do. And, quick note for everyone listening, if you've always wondered how to use AI in your healthcare analyst job and would like the full notes with the actual AI prompts I used, find the link in the description or comments.
Right. The prompt engineering is key. I told it. You are the Senior Health IT Business Analyst. Summarize the core requirements from the transcript below. Include any gaps or points that need clarification.
Okay, Senior Health IT Business Analyst, giving it a role. And asking for gaps, that's smart. So what came back?
It was surprisingly good. It pulled out the main things. Patients wanting real-time access to lab results, the need for mobile notification.
Notifications, okay.
Yeah, but interestingly, the AI flagged that. It said clarification needed on notification type, like SMS, push notification, email. The meeting hadn't specified.
Wow, okay. So it didn't just summarize, it actually identified an ambiguity.
Exactly. It acted like a really efficient assistant, catching that straight away, saved me having to reread everything multiple times just to spot those kinds of things.
That's genuinely useful. So you had this summary, plus a flag about notifications. What next?
Well, the next logical step was user stories. So I used another prompt, something like, generate user stories based on the requirements in the format. As a user type, I want to action, so that goal.
Translating requirements into user needs. Standard BA practice, but automated.
Right. And it did a great job. Generated things like, as a patient, I want to view my lab results immediately so that I stay informed.
Makes sense.
And as a patient, I want to receive mobile alerts when results are ready so that I don't have to keep checking. It even created one for the tech team.
Oh.
Yeah, as a developer, I want to create a back-end event trigger so that notifications can be automated. Cover different angles.
That's pretty comprehensive, just from the transcript and a couple of prompts.
It really was. Then, building on that, I asked the AI specifically about follow-up questions, based on its own summary and the gaps it found.
Okay, so you prompted it to help you prepare for the next conversation.
Precisely. I asked it to identify clarifying questions, and it suggested things like, the preferred mobile notification types we already mentioned.
Right.
But also, should patients be able to reply to secure messages? Or is it one way? And is secure messaging just with your main doctor or specialist too? Scope questions.
Those are exactly the kinds of details that can trip up a project later if they're not nailed down early.
Having the AI suggest them based on the meeting context was incredibly helpful for structuring follow-up discussions, made them much more focused.
Okay, this is impressive. Summaries, user stories, clarifying questions. Did you take it further?
I did. The next step was maybe the biggest time saver. I asked the AI to draft a preliminary business requirements document, the BRD.
The BRD, okay, that's often a huge task for analysts. days, sometimes weeks of work,
It
right?
can be, yeah, especially getting that first draft down. So I prompted it using the requirements and stories it had already generated.
And what did the draft BRD look like?
It was really solid for a first pass. It had the project overview, City Care Patient Portal enhancement. It listed the functional requirements, view results, trigger notifications, secure messaging.
Yeah.
It included the user stories we talked about. It listed some basic assumptions like, assuming the backend system can trigger events or that secure comms are technically supported.
Sensible assumptions to list.
And crucially, it included a section for open questions, basically listing those clarification points it had identified earlier.
So it pulled everything together into a structured document.
Yes, and importantly, the output wasn't just raw text. It was clean, professional formatting. I mean, it wasn't finished, obviously needed my review and refinement, but it was an incredible starting point.
I can only imagine the time saved compared to starting from a blank page after a busy meeting.
Easily hours, maybe days, depending on the meeting complexity. It let me focus immediately on refining, validating, and discussing the ambiguities rather than just typing up notes.
That's the real value proposition, isn't it? Freeing up your expertise. So how did you keep track of all this? You've got requirements, questions.
Good question. I just used a simple Google Sheet. Set up a basic requirements tracking checklist.
Okay. What kind of columns?
Pretty straightforward.
Yeah.
Meeting date, the feature area like lab results. Then the specific requirement like real-time view. The source, did it come straight from the transcript or an AI prompt?
Ah, traceability. Yeah.
Yeah, and which specific AI prompt I used, if applicable. And finally, a simple clarified column, yes, no, or pending.
Simple, effective, keeps everything organized.
Helps make sure nothing falls through the cracks as the project moves on.
And the tools you use for all this Teams, ChatGPT, anything else?
Just Google Sheets for the tracking, like I said, and Google Docs eventually for the refined BRD. So Teams, ChatGPT free version, Google Sheets, Google Docs, really accessible stuff.
No expensive, specialized AI platforms needed for this workflow.
Not at all. That's what made it so practical to try out.
So for anyone listening, particularly if you're a healthcare BA or in a similar role, the actionable advice here seems pretty clear.
Yeah, I'd say give it a try. Take a transcript from a recent meeting, maybe one where requirements were discussed, paste it into ChatGPT or a similar tool. Use that prompt I mentioned. You are a senior health IT business analyst.
Summarize core requirements, identify gaps.
Exactly. Just see what it produces. You might be surprised how much time it could save you on that initial processing step.
It really shifts the focus, doesn't it? From manual transcription and structuring to reviewing, refining, and using your core analytical skills.
It does. It lets me spend more time on the complex parts, understanding the clinical workflows, stakeholder management, the why behind the what, rather than just documenting the what.
It feels like the role of the healthcare analyst is genuinely evolving with these tools.
I think so.
Yeah.
Analysts who learn to leverage AI effectively, to get clarity faster, spot issues earlier, communicate better, they're going to be really valuable.
Moving from getting bogged down in documentation to using AI to amplify your impact.
It's about augmenting our skills, not
Right.
replacing them.
So a final thought for you listening. Where in your own workflow, maybe even beyond meeting notes, could AI potentially take on some routine tasks, freeing you up for more strategic thinking?